Symptoms of diabetes. What are the symptoms of type 1 diabetes? Type 1 diabetes is the same as juvenile diabetes mellitus. Most type 1 diabetes has an early onset between the ages of 9 to 14 years of age and is often referred to as early onset diabetes. The symptoms to look for in type 1 diabetes are increased thirst, increased urination, constant hunger, significant weight loss in when constantly eating, fatigue, dizziness, headache, nausea, vomiting, confusion, fruity odor to breathe, absence of menstruation in girls, bedwetting. It is important to remember that a child who might have type 1 diabetes will not always have all the above symptoms. In fact, some may not have any. This is the reason to always have regular medical checkups. Type 1 diabetes is a very serious chronic condition and should be treated immediately. Onset of type 1 diabetes is very rapid, so a parent should not dismiss any of these symptoms as just the needs of a growing child. If a parent suspects there is a problem, they should check medical attention for the child or adolescent as immediately as possible. Symptoms of type 2 diabetes include increased thirst by frequent urination. The excessive sugar buildup in the blood causes the body to take fluid from tissues. This usually leads to extreme thirst, so you may drink and urinate more than normal. Increased hunger, common even after eating. Without insulin to move sugar to the cells of the body, organs and muscles become void of energy, thus triggering extreme hunger. Loss of weight. Even when eating more to relieve hunger, you can lose weight. This is because of the inability to use glucose, which leads the body to use alternative fuels, which are stored in fat and muscle. As excess glucose is lost through urination, calories are lost. Fatigue or weak and tired feeling. If the cells are depleted of sugar, you may become irritable and tired. Blurred vision. When the blood sugar is too high, fluid is pulled from everywhere including the lenses of the eyes, which affect the ability to focus clearly. Slow healing or frequent infections or sores. Type 2 diabetes has an effect on the body's ability to resist or heal infections. Areas of dark skin. Some patients with type 2 diabetes have patches of velvety, dark skin in folds and creases of their body, such as the armpits and neck area. This condition is known as acanthosis nigricans, which is a sign of insulin resistance. Loss of consciousness, which is rare. Other symptoms of type 2 diabetes that may develop are itching skin, commonly around groin or vaginal area, numerous yeast infections, tingling and numbness of the feet and hands, recent weight gain, decreased vision, impotency. Just remember, if you have these symptoms of type 2 diabetes, you must see your medical professional as quickly as possible. The faster you are diagnosed, the faster you can begin treatment. You can have this disease for years and may possibly already have damaged or complications of your health. Symptoms of gestational diabetes. Generally, gestational diabetes might not cause any symptoms, but the pregnant woman may experience a large gain of weight, extreme hunger and thirst, excessive urination, or recurrent vaginal infections. The list of possible symptoms include frequent urination, extreme hunger, excessive thirst, unusual weight loss, irritability, increased fatigue, blurry vision. When a woman is experiencing any of these symptoms, she should check medical attention early. In fact, a woman should seek medical attention when she begins to think about becoming pregnant. The doctor will address gestational diabetes when the woman gets pregnant as part of her regular prenatal care. Gestational diabetes is detected through a glucose tolerance test, which is taken from week 24 through week 28 of the pregnancy. But if the woman is considered at risk, the doctor may test as early as 13 weeks. With gestational diabetes, a woman is more likely to need to have a cesarean delivery than women who do not have diabetes. Diabetes insipidus. Diabetes insipidus is a disease or condition involving the kidneys and the inability to retain necessary fluid. This leads to extreme thirst as well as increase in urination. The major symptoms of both these types of diabetes insipidus are excessive thirst and increased urination. The patient may be drinking great amounts of water but immediately loses it in urination. Nephrogenic diabetic insipidus may be caused by kidney disease, example polycystic kidney disease, as well as by the effects of various drugs or medication. Central diabetes insipidus is caused by a tumor or damage to the hypothalamus or pituitary gland. Diabetes insipidus can affect the body by causing extreme dehydration because the body is not retaining any sufficient amount of water to function properly. Dehydration is the complication which has the symptoms of dry mouth, low blood pressure, muscle weakness, sunken appearance of the eyes, headache, high fever, rapid heart rate, weight loss. Diabetes insipidus can also cause an imbalance in the electrolytes which circulate in the body. These electrolytes include sodium, magnesium, potassium, calcium, and phosphorus. An imbalance may cause the symptoms of headache, weakness, and pains in the muscles. You should see the doctor immediately if you notice the two most common signs: excessive urination and extreme thirst. Severe symptoms of diabetes. If a person has diabetes and experiences any of the following, immediately call a healthcare professional. Experiencing diabetic symptoms. This may mean that the person's blood sugar level is not being controlled despite treatment. Blood sugar levels, when tested, are consistently high, more than 200 milligrams per deciliter. Persistently high blood sugar levels are the root cause of all the complications of diabetes. The patient's blood sugar level is often low, less than 70 milligrams per deciliter. This may mean that the diabetes management strategy is too aggressive. It also may be a sign of infection or other stress on the body's organs such as kidney failure, liver failure, adrenal gland failure, or the concomitant use of certain medications. An injury to the foot or leg, no matter how minor, even the tiniest cut or blister can become very serious in a person with diabetes. Early diagnosis and treatment of problems with the feet and lower extremities, along with regular diabetic foot care, are critical in preserving the function of the legs and preventing amputation. Low-grade fever, less than 101.5 Fahrenheit, is a sign of infection. In patients with diabetes, many common infections can potentially be more dangerous for them than for other people. Note any symptoms such as painful urination, redness or swelling of the skin, abdominal pain, chest pain, or cough that may indicate where the infection is located. Nausea or vomiting can keep liquids down. Persistent nausea and vomiting can be a sign of diabetic ketoacidosis, a potentially life-threatening condition as well as several other serious illnesses. Small sores or ulcer on the foot. Any non-healing sore or ulcer on the feet or legs of someone with diabetes needs to be seen by a medical professional right away. A sore less than 1 inch across, not draining pus and not exposing deep tissue or bone can safely be evaluated by a healthcare professional as long as the patient does not have fever and their blood sugar levels are under control. Diabetic emergency. Altered mental status. Lethargy, agitation, forgetfulness, or just strange behavior can be a sign of very low or very high blood sugar levels. If a person has diabetes with an altered mental status, try giving them some fruit juice about 6 ounces or cake icing if the person is awake enough to swallow normally without choking. Avoid giving things such as hard candy that can lodge in the throat. The healthcare provider can prescribe glucose wafers or gels that melt under the tongue. Does not wake up and behave normally within about 15 minutes, then call emergency. Is not a known diabetic, these symptoms can be signs of stroke, drug intoxication, alcohol intoxication, oxygen starvation, and other serious medical conditions. Nausea or vomiting. If the patient is known to have diabetes and cannot keep food medications or fluids down at all, they may have diabetic ketoacidosis, hyperosmolar, hyperglycemic non-ketotic syndrome, and another complication of diabetes. If the person has not already taken the latest insulin dose or oral diabetes medicine, do not take it without taking to a medical professional. If he already has low blood sugar levels, taking additional insulin or medication will drive the blood sugar level down even further, possibly to dangerous levels. Fever above 101.5 Fahrenheit. If the primary healthcare professional cannot see the patient right away, seek emergency care for a person with diabetes with a high fever. Note any other symptoms such as cough, painful urination, abdominal pain, or chest pain. High blood sugar level. If the patient's blood sugar level is above 400 milligrams per deciliter and the primary healthcare professional cannot see them right away, go to the closest emergency department. Very high blood sugar levels can be a sign of diabetic ketoacidosis or hyperosmolar hyperglycemic non-ketotic syndrome. Depending on the type of diabetes the person has, both of these conditions can be fatal if not treated promptly. Large sores or ulcers on the feet or legs. If a person has diabetes, a non-healing sore larger than 1 inch in diameter can be a sign of potentially limb-threatening infection. Other signs and symptoms that merit immediate care are exposed bone or deep tissue in the wound, large areas of surrounding redness and warmth, swelling, and severe pain in the foot or leg. If left untreated, such a sore may ultimately require amputation of the limb. Cuts or lacerations. Any cut penetrating all the layers of skin, especially on the legs, is a potential danger to a person with diabetes. Proper wound care, although important to anyone's recovery, is especially important in diabetics to assure proper wound healing. Chest pain. If the person has diabetes, take very seriously any pain in the chest, particularly in the middle or on the left side, and seek medical attention immediately. People with diabetes are more likely than non-diabetic people to have a heart attack with or without experiencing chest pain. Irregular heartbeats and unexplained shortness of breath may also be signs of heart attack. Severe abdominal pain. Depending on the location, this can be a sign of heart attack. Abdominal aortic aneurysm, widening of the large artery in the abdomen. Diabetic ketoacidosis, or interrupted blood flow to the bowels. All of these are more common in people with diabetes than in general population and are potentially life-threatening. People with diabetes also get other common causes of severe abdominal pain such as appendicitis, perforated ulcer, inflammation and infection of the gallbladder, kidney stones, and bowel obstruction. Severe pain anywhere in the body is a signal for timely medical attention.